insurance. And we have Dr. Hakim with us. He is also a dental surgeon. And I would like to give Dr. Hakim, can you please come on? So he will give you some idea how the insurance works, how you can facilitate that in more, so that more patients can come to your hospital. Because insurance and budgeting is always a concern for any international patients to come over.
Thank you, Dr. Kapadia. Once again, Dr. Katende Hakim Kato, a dental surgeon, CEO BZB Dental Services, and a coordinator in the Central, Western, and Northern region in the Federation. So, my being here is to throw more knowledge about insurance in our country under the umbrella of medical insurance. In Uganda, we have 11 insurance companies, but all of them, they are under the Insurance Regulatory Authority. And those 11 are divided into 3. We have the general insurance, which takes 6 companies. We have the life insurance, which have 3 companies. And then we have what we call the health management organizations. And that one has 2 companies. That is Case Hospital and then AAR. Now, when it comes to the insurance policies, what you have to note or to understand is we have what we call the company and then an individual. You may be insured by the company where you're working, or you might be insured individually. Okay? As an individual, you're paying your own premiums, or the company is paying premiums for you. So, if it is the company will have to look for a service provider. When we come to medical, what are the services being provided? We have the inpatient, we have the outpatient, we have the dental, we have the optical. We also have others, those with chronic illness, congenital issues, and others. So the company will have to choose, will come to your facility and find out whether you have these services. And then you will have to negotiate the bills. If you're a dentist, how much is your root canal treatment? If you are a dentist, how much will you charge for orthodontic treatment? Remember, in our country, we don't have specific costs for a specific treatment. You may come to me, you have a dental problem. It will depend on the way you appear, or it will depend on the company you're coming from. Where I would give an orthodontic treatment at a cost of 5 rupees to an individual. When a company comes in, I say this is a company, let it be 10 rupees. Because we don't have specific cost for a specific treatment. So in that line, you have to discuss with the insurer. So it will be your convincing time to convince the company to give you the contract to treat their patients. Or it will be your convincing time to convince an individual, so that this individual goes to the company providing, which is responsible to pay for that treatment. I hope you are clear with that. When it comes to referral cases, they are certain, because we still have a very big gap in our medical services. That though we might be having specialists there, but the equipment is lacking to do certain things. There is what we call referral overseas. Okay, that you come to my facility. Yes, I'm a dental surgeon. We also have oral maxillofacial surgeons who handle tumor issues. But you consult your colleague or senior that I have such a patient and the insurance is ready to do this. Now the OMF will tell you, no, we can't manage this. How do we do that? Can we refer to India? So in that case, there is what we call referral overseas, whereby the patient will be referred to India and a surgery will be done. So if a surgery is done, it is either way. The insurance can directly pay, or an individual or the company where the individual is working can pay, and then they go to the insurance company and then they get reimbursed with their payments. The other issue, there is a scenario when I'm insured and I'm in India. I traveled to India maybe for a holiday. Then I get a medical issue. There's what we call temporary overseas. And if I get treatment in this site, I will go back to Uganda and claim for payments. But that one lasts for 6 weeks. I may either pay, okay, myself or communicate to the insurance company.
So, in general, anybody have a specific question?
Say, first, whether the infertility is covered into the insurance sector or not.
Come again?
Infertility. Infertility is covered in the insurance or not in your country?
All right. Like I've said, we still have a gap, a medical gap. Now, when you go into insurance issues with our country, there are certain specialties where the company or the insurance company cannot pay for your treatment. So you have to go into an agreement. You have to ask the company what is insured and what is not insured. And remember, in our country, when it comes to specialties or specialized hospitals, currently in the government we have one. And when it goes to the private, the specialized one more so in your specialty, they are two. And they are extremely expensive. So certain insurance companies will say we are not paying for that. Others, those who work in companies, they are companies like telecom companies, industries, they are able, they will say you go to any country, you get a treatment, we shall pay. So it depends on the way how you negotiate it. What is here, what is not there. What can you get from here, what you can't get from here. So it depends. It's all about negotiations.
So it's all about the corporate companies who cover, companies can cover, but the individual insurance won't cover. Is it like that?
Yeah, like I've said, let me give you a scenario. You are insured. For example, you are under the health management organizations. That is, you are attached to Case Medical Center. And you have issues with infertility. Case cannot handle a case. But you are under that. So Case has a responsibility to refer you overseas, and then Case will have to pay for those costs for the treatment you got. I hope we are okay now.
In general, if a hospital here in India wants to tie up with corporates or any other companies in Uganda, how to facilitate? They all want to tie up with corporate companies in Uganda. What certain steps they need to take?
All right. The question is, if a hospital here wants to cooperate with the companies the other side, what are the steps? Like, these insurance companies are under a single umbrella, that is the Insurance Regulatory Authority. That umbrella has what we call agents, brokers, and then bank agents. So you have to go through those agents, okay? And then they will link you to the insurance companies, which are under the other umbrella. They are all controlled by the Insurance Regulatory Authority. So you have to go through their agents and give in your request. Yes.
Can you facilitate that part?
The Federation? I think that question will go to the Secretary General. Smile.
Come again, sir.
Link, if we, the hospital this side wants to get a link with the insurance company in our country, can the Federation facilitate that?
Oh yeah, that's very pretty much possible. In fact, what we wanted to talk about that is we're in touch with all insurance companies. In fact, the other thing, doctor, is with the federal, go through the ministry, or you can go through a registered federation like this one we have. So our federation is in direct contact with all those authorities because they even cover private hospitals. In fact, the insurance companies in Uganda, 99% deal with the private hospitals because government hospitals don't have good facilities. Thank you.
So to connect federation just for insurance. Look at the things. So that is the more potential area we can work upon. Besides the patient exchange, direct patient exchange and by the insurance way.
Reimbursing some diseases like newborn baby who born with some congenital anomalies like birth defect is there. They are not covering in under the insurance company. So what are the rules and regulations or terms and conditions for the insurance company? Which are limitations over there?
Still, I'll repeat myself.
I think
When you go to any insurance company, their policies, there are certain things they cover, there are those they don't cover. You might be insured individually. If I go in an insurance company, we go into an agreement that I'm insuring this. In case you get an accident, I'm responsible. But if you get a chronic illness, I'm not responsible. There are certain things they won't cover. So it's just an agreement. You have to.
I think that is a very deep question. So we need to look at individually, and rest of the things they are not in depth have the detailing about the concept. But we need to negotiate with the insurance company. These are the my elements. What you can cover on that part.
What Dr. Hakim was saying, what I understood was that some patient is coming to your hospital and you want to facilitate the overseas for that particular patient. You can refer the patient overseas to a particular hospital in India. Through your channel, we are not directly linked to the insurance. You are linked to the insurance and you are just sending the patient overseas.
Alright, like I said, the insurance in our country is divided into three. We have the general insurance, where we have members in that line. We have the life insurance, we also have members in that. And that one specifically houses hospitals. So when you come to that facility, and the service is not there, it is the responsibility of that hospital, because it is acting now as an insurance body, that it will give payments for any overseas referral treatment. You get it? All right.
And the insurance will bill the organization. That's how they do it.
I think that part covers almost the insurance in general, but those who wish to connect for this particular insurance tie-ups, we will go one by one. So that will be individual session after this.